Welcome to Life Learning. I'm presenting a lecture today on heart disease. My name is Dr. Matus Bursik. I'm an emergency doctor in Manly Hospital. I've studied medicine at the University of Sydney and have been practicing for about 12 years. Heart disease is an important topic because it's actually the #1 cause of morbidity and mortality in the Western world. It's very common, causes a lot of health problems. It's something I see very frequently in the emergency department. So it's important to understand what it is, but also understand what factors cause it and how we can modify some of those factors to prevent it. So in today's speech, we're going to be having a look at the overview of what heart disease is. And then we're going to focus on atherosclerotic heart disease, which is the most common heart disease that causes heart attacks. We're going to then have a look at hypertensive heart disease, because it's also very common, hypertension being so common in our Western society. And then we'll look at the risk factors that cause heart disease and some of the solutions that we can implement in our lives to try and prevent that. So let's start with an overview of heart disease. So what are the types of heart disease? So the most common type that we know is the myocardial infarct, which is what is known as the heart attack. And in this case, it's when blood flow to a part of the heart is obstructed, usually by a plaque or a clot, and that causes a part of the heart muscle to die and causes heart problems. You can also get something called heart failure. This can be caused by a lot of different reasons, but it's when the heart doesn't pump adequately and it just doesn't keep up with the supplementation of blood flow circulating, and that causes its own problems. Cardiomegaly is important. It's often caused by hypertension, although there's other causes. And that causes the heart to expand, and then that causes it to fail as well or pump ineffectively. And lastly, we've got angina. Angina is a bit of a precursor to myocardial infarction. It's when there's a narrowing of the cardiac vessels or arterioles to a point of degree where the heart's not getting enough oxygen and blood, but it's still getting some, and you experience it as a pain in your heart, especially on exertion. It usually settles down when you stop moving or exercising. So what are the types of cardiovascular disease? So this is including the heart and also the blood vessel systems in your body. So we also, there's on the left there, we've got the rheumatic heart disease. We don't see this very often, although it used to be common. It's a particular heart disease that often affects the heart valves, and it's caused by a particular bacteria, a strep bacteria, that can develop, say, in your throat, and then it can spread to the heart. It used to be common before antibiotics, but now that we treat a lot of bacterial infections with antibiotics, we don't see it as much. Hypertensive heart disease is a very important one to note because hypertension is so prevalent. And this causes heart failure because of the stresses it puts on the heart. And also, hypertension also causes stroke, which is another important disease process. Ischemic heart disease there in the middle is caused by the narrowing of the arterioles or the pipes. And if they narrow to a point where they are fully occluded, it causes what's called a myocardial infarction. If it's narrowed only to 90% and not fully, it causes something called angina, which we've discussed, which is just chest pain, but not actually death of heart tissue. Another cause of cardiovascular disease is inflammatory heart disease. This can be caused by infections like viruses or bacteria, or it can be caused by autoimmune processes. And it's when part of the heart becomes inflamed, like it can be the covering of the heart, which causes pericarditis, or the inside of the heart, which causes endocarditis. And this is a fairly common process that happens as well. Stroke is there at the end. It's more of a process that happens in the vasculature of the brain. Doesn't happen in the heart, but it's an important process that happens in, I guess, the vascular aspect.